Hello, everyone, and welcome. If you're studying homeopathy, you know how crucial it is to get a handle on chronic conditions. So today, we're going to break down the homeopathic framework for managing arthritis. Think of this as a detailed study guide to really help you master the key concepts. First things first, why is this topic so incredibly important? Well, get this. According to our source material, a staggering 1 in 4 people in India is dealing with arthritis. I mean, think about that. This isn't some rare illness. It's a huge public health issue. That's exactly why having a deep understanding of all the different therapeutic approaches is, well, it's non-negotiable for us. Okay, so here's our game plan for this study session. First, we'll look at the 2 big treatment paths out there. Then, we're going to dive deep into the absolute core of homeopathy, what's called the mind method. After that, we'll get practical and look at the diagnostic process, see how a remedy is actually chosen, and then wrap everything up with a head-to-head comparison of the 2 philosophies. All right, let's jump right in. Section 1, the 2 paths. You see, when it comes to managing arthritis, there's a really fundamental choice to be made. Are we just looking for quick symptom relief, or are we aiming for something deeper, a more holistic, long-term healing from the inside out? And this slide, it just lays out that core difference so clearly, doesn't it? On one side, you've got the conventional or allopathic goal, which is all about getting that fast relief from pain and inflammation. But homeopathy, it's playing a different game. The goal here is to actually stimulate the body's own vital force. You know, its built-in capacity to heal itself. Now, to really appreciate the alternative, you first have to understand the potential downsides of sticking with conventional treatments long-term, and the source material is pretty clear on this. We're talking about things like prolonged use of NSAIDs, which can lead to serious damage in the stomach and kidneys. And that's not all. There are also cardiovascular and liver risks, plus a very real danger of dependency with some of the more powerful painkillers. So you can see why both patients and practitioners are often looking for other answers. And that search for other answers brings us right here to Section 2. This is where we get into the heart of the homeopathic approach, often called the mind method. The big idea here is a total shift in perspective. We stop focusing just on the painful joint and start looking at the whole person. This is what we as homeopaths call the constitutional approach. And believe me, this is a cornerstone concept for any student. The idea is that the physical symptoms, the pain, the stiffness, they aren't really the disease itself. Think of them more like signals or smoke from a fire. They are the outward signs of a much deeper, internal imbalance that's often connected to the person's mental or emotional state. So what's holding this method up? Well, there are 2 key pillars. First, there's psychoneuroimmunology. And yeah, it's a mouthful, but it's basically the established science that shows how our thoughts and feelings directly affect our immune system. And that's absolutely critical in autoimmune types of arthritis. The second pillar is the concept of miasmatic foundations. Now, in homeopathy, a miasm is essentially an inherited predisposition to certain chronic diseases. You can think of it as a kind of deep-seated blueprint for health issues. So the goal isn't just to treat today's symptoms, but to address these inherited tendencies to promote a much deeper healing. Okay, so we've got the philosophy down, but how does it actually work in the clinic? That's what this next section is all about, the 4 diagnostic pillars. Just think of this as the step-by-step method for taking a case, for gathering all those little clues you need to find the perfect remedy. And here they are, the 4 pillars. First up, we get a mental, emotional snapshot. Then, we look at the patient's physical generalities. Third, we nail down the modalities, basically what makes things better or worse. And finally, we get into the really specific sensations of their pain. Every single pillar adds another essential layer to the puzzle. So let's really dig into the first 2, the mental-emotional pillar. This isn't just asking, how are you feeling? It's about finding what is strange, rare, and peculiar about that person. Like, did their arthritis flare up right after a major loss? Do they desperately need sympathy, or do they just want everyone to leave them alone? Then you have the physical generalities. These are traits that affect the whole body. Is this person always cold, the one who needs a sweater in summer? Or are they hot-blooded, always cracking a window? Do they have intense cravings for salt, or maybe sweets? All of this together starts to paint a really unique picture of the patient. Now, this is where it gets really fascinating, because this is where homeopathy listens to the body's story. Pillar 3, modalities, is all about the triggers. What makes things better or worse? Does the pain go crazy in damp weather? Does moving around actually help? Then, pillar 4, specific sensations, gets into the quality of the pain. A homeopath doesn't just ask, where's the pain? They ask, what does it feel like? You get these amazing descriptions from patients like hot needles pricking the bone.
These aren't just details, they are the most important clues we have.
Right, so we've gathered all this information from our 4 pillars. Now what? Well, this next part is all about the art of matching those clues to a specific remedy. And in homeopathy, we often think of these remedies as having their own archetype or personality.
Okay, let's take a classic example. I want you to picture a patient telling you this word for word. The pain is terrible when I first start to move, but once I get going, it actually gets better. Now, for any student of homeopathy, a statement like that should set off alarm bells. In a good way. It's a huge signpost.
And that feeling, that rusty hinge sensation, as we often call it, it points us directly to one specific remedy archetype, Rus toxicodendron, which you could call the restless archetype. You see how perfectly the remedy's known profile matches this very specific experience of pain? It's just a beautiful example of how one precise symptom can lead you right to the prescription. And of course, it works for other patterns too. Let's say a patient describes the complete opposite, that any little movement makes the pain unbearable. Well, that's a totally different story, and it would make a homeopath think of something like Bryonia alba. Or what if the pain isn't in one place? What if it seems to wander from joint to joint? That might point towards pulsatilla. You really start to see how the treatment is tailor-made for each person's unique experience. Okay, let's pull all these threads together in our final section. We started this whole discussion by talking about 2 different paths, and now we're going to come full circle and really lay out the differences in their core philosophies. This is where we bring it all home.
And this table from our source really just says it all, doesn't it? Let's walk through it. What's the primary goal? For homeopathy, it's stimulating the body's own healing. For conventional medicine, it's rapid relief. What about side effects? With homeopathy, because of the potentization process, they're minimal to non-existent. Compare that to the high potential for organ damage with long-term conventional drugs. And the treatment itself? Homeopathy is deeply individualized using that mind method. Conventional care relies on standardized protocols. And finally, dependency. No risk of addiction with homeopathy versus a high risk with certain painkillers. It's really night and day, a completely different way of thinking about health.
So we're left with this really important question, and it gets to the absolute heart of the matter. As we all face this rising tide of chronic diseases like arthritis, where do we put our energy? Is the future all about finding faster and faster ways to manage symptoms? Or does it lie in a more patient, more profound, and truly individualized path to healing? It's a critical question for all of us to think about, whether you're a patient, a practitioner, or a student. Thanks so much for joining me for this study session.